Schizophrenia is a chronic, severe mental disorder that affects the person's ability to think clearly, manage emotions, make decisions, and relate to others. It often involves hallucinations, delusions, disorganized thinking, and impaired insight. Schizophrenia typically begins in late adolescence or early adulthood and requires lifelong treatment. Although it can be challenging, appropriate treatment, therapies, and support can help many individuals lead fulfilling lives. Overview: prevalence. Schizophrenia affects about 1% of the population worldwide. Onset generally appears in late teens to early 30s, often earlier in men than in women. Course: symptoms may fluctuate over time, with periods of acute episodes and remission. Types of schizophrenia: paranoid schizophrenia, characterized mainly by prominent delusions and auditory hallucinations. Disorganized schizophrenia, marked by disorganized speech, behavior, and inappropriate emotional responses. Catatonic schizophrenia involves motor dysfunction, such as immobility, mutism, or extreme physical agitation. Undifferentiated schizophrenia displays symptoms of multiple types without fitting into one specific category. Residual schizophrenia, characterized by a history of schizophrenia but without active delusions or hallucinations. Symptoms: schizophrenia symptoms are typically classified into three categories. Positive symptoms added to normal functioning. Hallucinations, most commonly auditory, hearing voices, but they can also be visual, tactile, or olfactory. Delusions, strongly held false beliefs that conflict with reality, such as paranoia or grandiose beliefs. Disorganized thinking, trouble organizing thoughts, often leading to incoherent speech. Abnormal motor behavior, may range from childlike silliness to unpredictable agitation. Negative symptoms: reduced from normal functioning. Affective flattening, reduced emotional expression and facial responsiveness. Anhedonia, difficulty experiencing pleasure in everyday activities. Social withdrawal, loss of interest in social relationships or engagement. Lack of motivation, difficulty initiating tasks, leading to apathy. Cognitive symptoms affecting thought processes. Impaired attention, difficulty focusing or concentrating. Poor memory, difficulty recalling information or learning new things. Impaired executive functioning, difficulty planning or making decisions. Causes and risk factors: the exact cause of schizophrenia is unknown, but it likely involves a combination of genetic, biological, and environmental factors. Genetics. Family history of schizophrenia increases the risk. However, it's not caused by a single gene but likely by multiple genetic interactions. Brain structure and chemistry. Changes in brain chemistry, particularly imbalances in dopamine and glutamate, as well as structural abnormalities, may contribute to symptoms. Environmental factors: prenatal exposure, exposure to toxins, malnutrition, or infections during pregnancy may raise risk. Stressful life events, trauma or high stress during adolescence or early adulthood can trigger symptoms in those genetically predisposed. Substance use: certain drugs, particularly cannabis and amphetamines, can increase the risk of schizophrenia or worsen symptoms. Diagnosis: diagnosing schizophrenia involves a comprehensive assessment, including a physical exam, psychiatric evaluation, and discussion of symptom history. The diagnosis usually requires symptom duration: persistent symptoms for at least 6 months, with at least 1 month of active symptoms. Hallucinations, delusions, or disorganized speech. Impaired functioning: significant disruption in work, relationships, or self-care. Rule out other conditions. Conditions like bipolar disorder, major depression, or drug-induced psychosis must be ruled out. Treatment for schizophrenia focuses on managing symptoms and improving quality of life. This usually requires a combination of medications, therapies, and social support. Medications. Antipsychotics, primary treatment for schizophrenia, helping reduce hallucinations, delusions, and disorganized thinking. Second-generation atypical antipsychotics, risperidone, olanzapine, and aripiprazole are commonly used due to fewer side effects. First-generation typical antipsychotics, haloperidol and chlorpromazine, effective but with a higher risk of side effects, such as tremors. Long-acting injectable antipsychotics, beneficial for those with difficulty adhering to daily medication. Psychosocial therapy. Cognitive behavioral therapy (CBT) helps manage delusions, hallucinations, and reduce distress associated with symptoms. Social skills training improves social interactions and communication. Vocational rehabilitation assists individuals in returning to work or school, promoting independence. Support systems. Family education and support. Family involvement can improve outcomes by offering emotional support and understanding. Community support programs provide housing, employment support, and structured daily activities. Self-help and peer support. Involvement in peer support groups helps with coping, understanding symptoms, and reducing stigma. Hospitalization. In severe cases, short-term hospitalization may be needed for stabilization, especially if there's a risk of self-harm or harm to others. Complications. If untreated or poorly managed, schizophrenia can lead to several complications. Social isolation. Difficulty maintaining relationships can lead to isolation and loneliness. Substance abuse. Some people may turn to drugs or alcohol as a coping mechanism. Self-harm and suicide. There is a high risk of suicide among people with schizophrenia, especially during early stages. Health issues. Individuals with schizophrenia are more susceptible to health issues like obesity, diabetes, and cardiovascular disease, often due to medication side effects and lifestyle factors. Prognosis. The outlook for schizophrenia varies. With effective treatment, many people can manage symptoms and lead fulfilling lives. Early intervention, continuous treatment, and supportive networks greatly improve the chances of better long-term outcomes. However, schizophrenia remains a lifelong condition requiring ongoing care and symptom management. Conclusion. Schizophrenia is a complex mental health disorder that significantly impacts individuals and their families. While it poses substantial challenges, modern treatments, therapies, and support systems enable many people with schizophrenia to lead meaningful lives. Early diagnosis, consistent treatment, and comprehensive support networks are essential for improving quality of life and reducing the impact of the disorder.